Good afternoon. This is Ed Ullmann, pharmacist at Wellness RX, the beautiful mountaintop wellness center in Tannersville, New York. I'm trying to keep you up to date on the coronavirus as we see it from our perspective. And I'll just begin to say, wow, what a week it has been. We have been speaking about the so-called social distancing, asking community members to avoid crowded environments where the virus has a higher probability of spreading. But no one could have predicted the speed of cancellations, the mandatory closings, the restrictions that we experienced as a nation this week. From cancellations of the NCAA tournament to the closings of now over 60,000 schools, and even to the limitation of access to our local high school play, West Side Story. No arena has been spared, and we are now witnessing the ultimate test of community sacrifice, and the economic fallout is just beginning. One of the biggest reasons, and people have been asking me, why the aggressive push to limit people-to-people transmission. The main reason from my perspective is that we've had a slow response to getting proper testing sites or testing kits. And without access to testing, our elected officials, our public administrators, our educators, private CEOs, they have had no choice but to be conservative and to act swiftly, and they have, especially in New York State. And in time, I believe we will understand the wisdom of this action. We continue to track the confirmed cases and the fatality rate very closely. Worldwide now, there are 206,845 reported cases of the coronavirus, and with Italy continuing to be hit, the hardest hit of any other nation. Worldwide, the fatality rate is about 4%. That's holding about the same, maybe up a little bit. And in Italy, it's a stunning 8%. The challenge is going to be greater than ever in Italy. We then said in the United States, where are we? We have 6,500 plus positive cases that were reported as of this morning. And we've had 116 reported deaths. Again, most have been older seniors, those who have been at nursing homes, those who've had compromised immune systems or are dealing with chronic illnesses like COPD. Now, our fatality rate was only 1.8% in the United States, and that's encouraging. In New York State, where the epicenter of the breakout is New Rochelle in Westchester County, we've had now 1,374 confirmed cases, but only 12 deaths. And so our fatality rate is now a little less than 1% in New York State. However, New York State now has the highest numbers of reported cases in the United States. And here in Greene County, we've had 2 reported cases. The important thing to note is that the dramatic daily increase, now this is every day when we're trying to track this, especially in New York, has been very, very significant. And it's going up every day from yesterday to today by 30 to 45% of reported positive cases. Now, most of these, 60%, are coming from New York City, which a population of about 8 million that we would expect. But I think we're going to see this aggressive numbers with the increase in access to testing. If this pace continues at this 30-45% reporting rate daily, then my estimation is that we will have 90,000 reported cases in 2 weeks here in New York State, and that will account for about 0.5% of our entire New York population. Again, I want to just remind you that our fatality rate here in New York is remaining low at less than 1%. This is not much greater than the fatality rate that we experience from the influenza virus each year. So that's something that we should be looking at. We also now know that 8 out of 10 of the coronavirus cases remain mild in nature. If an individual stays at home, they can recover in about 2 weeks. And we also know that kids remain at low risk for getting infected by the virus. Now, here are some of the updates from this week. First, we had the World Health Organization officially designating the coronavirus outbreak as a global epidemic. We then had our president declare the crisis a national emergency. And this followed with many other countless other state, county, townships, villages, including all of our own local municipalities. And as a side note, I wanted to say I had the privilege of attending a Town of Hunter meeting this week, talking about how things are coordinating locally to try to manage this crisis. I was impressed. We not only had the Town of Hunter officials, we had the village officials, we had our EMS, we had the superintendent of schools, we had contact with the county, we had Dr. Snyder giving up-to-date recommendations what we can do. We were talking and communicating in a very intelligent way. I was proud to be the local pharmacist that we will be opened every day as anticipated to meet the needs. And I think we all can feel very comfortable that we're in good hands, both with our local municipalities and the communication they have with our county, with our state, and also with Congressman Delgado at the federal level. We then next, and we can anticipate this, is that the House of Representatives have passed what's called the Families First Coronavirus Response Act. I believe the President will sign it into law any day. This act is intended to help those who are suffering greatly from the epidemic. This will include free testing, paid sick leave, family leave provisions, and loans to small businesses. The other good news is that the early hard-hit areas of China and South Korea appear to now start to see symptoms tapering off. That's good news. Now, if we stay committed to follow the mandates of social distancing, we continue to have our smart travel ban restrictions. We continue to voluntarily self-isolate when we get the flu, a family member gets the flu, or someone tests positive even though they have no symptoms. If we continue to use preventive and common sense techniques, our experts are suggesting that the United States epidemic may break or peak in about a month or two, and that we can then begin to start to regroup as a nation. That's positive news for us to look at. Now, as you know, testing for coronavirus has begun. In New York State, we now have our first drive-through testing center opened in the epicenter in New Rochelle. The center is now completing about 500 tests a day, and about 14% of the patients who are tested are testing positive. That's 14%. It's a number we should start to look at so we get a little indication as testing starts to increase in many other areas. What are we looking at among our populace that are either coming down with the flu, the beginning stages of it, or have no symptoms? In comparison, what we're looking at, New York State, at least we have a goal that we want to try to get to 6,000 tests daily. In comparison, South Korea, that's been dealing with the epidemic longer, is testing about 10,000 tests a day. Locally, our testing is being done at the Columbia Green hospital setting. It's under a restrictive basis. This is not to be used for individuals just wondering if they have been exposed or not. We have to use this specifically, the limited tests that we have for individuals who are identified as being positive in illness, or those who have been in a high-risk situation, or anybody that we have high probability from a health professional that they could be exposed, but they don't have any symptoms at this time. Now, as the testing of our populace continues to increase, our numbers are going to obviously increase. We'll be pretty soon up over 10,000 cases for it. And what that's also going to do is on the positive, is reduce our fatality rate. So if we're already at a fatality rate of about 1%, and we increase the numbers, hopefully we can stay there, which would be dramatically very positive for us. But we need to have the increased testing so that we can have, because this is key to containment and ultimately to control of the epidemic. The coronavirus remains a work in progress. Every day there's something new that is discovered about its characteristics or its treatment options. It's a different viral. Again, this is not influenza like we're used to. We don't know. Experts are still trying to figure out. So we now know, for instance, this week that Tamiflu will have no effect on the coronavirus. And that was our go-to antiviral medication that people could afford. So what is happening is that experts are now looking at antiviral medications that are used for HIV patients and certain antimalarial medications to see if these drugs can be effective or have a high probability of arresting the coronavirus once we get sick. We now are turning around, and I think that we'll continue to look at guidance from the CDC. We should still continue to look at guidance from all of our local municipalities. And we also have to take steps to continue to be prepared. You got to stay with the conventional wisdom for prevention, washing your hands for 20 minutes, blowing and sneezing into your arm, and try to use sanitizers and so on. It's very important. And remember, we are getting the virus primarily from droplets that are in the air that have been infected, and that when we sneeze, that 6 feet around us can be contaminated. So we have to be careful. We also got to continue to understand that all flus and colds, which are also a flu, have no impact by antibiotics because they're viral in nature. Therefore, to combat a viral infection, we must do it with a strong immune system, antiviral medications that will be proving to be effective for the coronavirus, and antiviral natural products. Remember, our immune system is designed to produce white blood cells at the first time that we've been attacked by germs of any nature. Therefore, it's important for us to maintain a strong immune system, and this is going to be a combination of hydration and diet and stress management and exercise and proper rest and supplements. For daily supplements, we continue to recommend a high-quality probiotic and natural products that have both antiviral and strong immune-boosting potential. Our number one recommendations for prevention continues to be mushroom tinctures, the reishi and the chaga in particular, and extracts in particular, and elderberry tonic. They're safe for both adults and kids. We also recommend taking 500 milligrams of vitamin C throughout the day. We understand there's a shortage of vitamin C. Hopefully we'll be able to get more inventory into the marketplace. And stay hydrated. We're also now recommending taking at least 2,000 international units of vitamin D, start to increase zinc supplementation, about 200 milligrams, and now it's not a bad time to introduce echinacea, about 500 milligrams daily to your diet. We also suggest adding more garlic and oregano to your diet, and please start to reduce the sugar intake into your diet. Sugar is not a friend of yours, especially if there's any germ in your body, because the germ will accelerate its growth with sugar. If any member of your family or yourself comes down with the flu, you've got to become aggressive. We suggest increasing your mushroom tincture to 3 times a day, increasing your vitamin C to 500 or 1,000 milligrams every 4 hours, and understand that if you are taking too much vitamin C, your body will tell you you'll get diarrhea. You stop then, reduce your dosage, and then continue. And then we also recommend that you have as a backup 500 parts per million of colloidal silver. We start recommending that you take a teaspoon twice a day for 5 days. And then we also continue to recommend that you increase your dosage of echinacea. These are safe, they're effective, and one final tip that we're recommending now is just simple saline spray. Just use a nasal spray, put it in both nostrils, and then get a very good antiviral therapeutic grade essential oil, and use the essential oil in both, put some in both ends of your nostril. So use the saline spray, use the essential oil, and use it before you go into any kind of a group setting or any kind of environment that you think you might be at risk. And we think that this can give you extra protection. Next few weeks and months are going to be challenging for all of us. The news reports are continuing to come out. We are going to continue to be being tested. We still suggest you rely very much on the CDC and our local municipalities for information, because they're going to be on the cutting edge of this. We've got to stay calm, and in the weeks to come, we at Wellness RX will try to continue to keep you updated on what we see from the street, and from everyday individuals, what's working, what's not working. We are all being tested as Americans right now. And I can report on one thing. It's a stunning compassion that is coming from just ordinary Americans. I can't tell you how many people are coming in to say, how can I help? Now, if there's anything positive coming, I think this trend is America at its best. And in this vein, I have a request to our young kids and our young adults today. Look around. If you know anyone in our community, especially seniors or anybody who's dealing with a disabled individual at home, or anyone that is homebound, and you know they need anything, whether it's toilet paper or whether they need supplies or whatever, including food, please reach out and let us know here at Wellness RX. And we will do our best to make sure that we get those supplies or those needs to the individuals of our community. Because just remember one thing, kids, we take care of our own on the mountaintop. Until next week.